In today's world, millions of people live with Parkinson's disease, a chronic neurological condition that can dramatically alter the quality of life. With this video, we aim to shed light on lesser-known but critical signs that may indicate the early presence of this debilitating disease. Today, we will embark on a journey of discovery about identifying the early signs of Parkinson's, empowering you with the knowledge you need to act before the condition advances. Discovering early signs and acting promptly can transform the treatment and prevention of worsening symptoms, significantly improving patients' quality of life. Understanding Parkinson's disease begins with awareness, and our mission here is to share this vital information with you and those who might benefit from it. We hope you find valuable information in this video that, in addition to clarifying doubts, helps you better understand this condition. Stay with us. Parkinson's disease is a progressive neurological disorder that predominantly affects movement but can also impact emotional and cognitive aspects. It manifests when the brain experiences a decrease in the production of dopamine, an essential neurotransmitter for coordinated control of movements. This deficiency results in characteristic symptoms such as tremors, muscle stiffness, and postural instability. The condition was first described by British physician James Parkinson in 1817, and since then, advances in medicine have provided a greater understanding of its causes and effects. Although Parkinson's is more common in older people, generally manifesting from the age of 60, it is not exclusive to this age group. There are cases of early-onset Parkinson's, where symptoms appear before the age of 50. Risk factors include genetics, exposure to environmental toxins, and family history of the disease. Statistics indicate that Parkinson's disease affects about 1% of the population over the age of 60, directly impacting millions of people worldwide. To understand the magnitude of the impact of this disease, it is crucial to recognize its complexity and the way it affects not only the diagnosed individuals but also their loved ones and caregivers. Recognizing the early signs of Parkinson's disease is crucial for the effective management of the condition. Early diagnosis allows for medical interventions before symptoms worsen, offering the patient a better chance to maintain quality of life. With advancements in diagnostic methods and brain mapping, neurologists can identify early traces of Parkinson's, enabling better preparation and care planning. Early interventions can help mitigate motor and non-motor symptoms, potentially delaying disease progression. Moreover, individuals quickly diagnosed may benefit from therapies, exercises, and lifestyle changes that help preserve autonomy and functionality for longer. Beyond the physical benefits, early diagnosis also has significant emotional impacts, allowing patients and their families to deal with the condition more proactively and with better support. Therefore, by identifying and addressing the disease as early as possible, complications can be reduced, and long-term prognosis can be improved, decisively transforming the experience with the disease. Identifying the early signs of Parkinson's disease is a crucial step for early diagnosis and effective management of the condition. This disorder often begins with subtle symptoms that may not be immediately obvious. Among them, tremors are the most known, often starting in one hand as a resting tremor. This tremor is characteristically more pronounced when the body is at rest and tends to diminish with movement. Muscle stiffness is another noticeable early symptom, where muscles feel tense and less flexible. This can severely impact posture and movement, leading the individual to feel discomfort when performing daily tasks. Additionally, bradykinesia, or slowness of movement, is a symptom accompanying those affected by Parkinson's early on. This slowness can cause difficulties in routine activities such as walking, getting up from a chair, or even speaking clearly and understandably. A surprising but significant sign is the change in handwriting, known as micrographia. People with Parkinson's often begin writing with smaller and less legible letters. This subtle indicator can be easy to overlook, but it is one of the early markers of the disease. Another lesser-known symptom is the loss of smell, a common complaint among individuals before any motor signals appear. This sensory decline can be an important clue regarding disease progression. Sleep problems are frequent, including insomnia and involuntary movements during the night, often disregarded but important. Sleep disturbances not only affect daily mood and well-being but are indicative of neurological decline. Finally, problems with balance and coordination begin to appear more frequently in the initial stages. Unexplained falls or a continuous sense of instability when walking may be alarms that something is wrong. Recognizing these signs and symptoms early is crucial, allowing individuals to seek medical assistance promptly, increasing the effectiveness of therapeutic interventions. This underscores the importance of being vigilant about the occurrence of these symptoms in oneself and loved ones, taking practical measures to ensure quick diagnosis and treatment, minimizing the long-term impact of the disease. By being aware of these early signs, patients are better protected against long-term complications, ensuring a more balanced and efficient approach to the challenges they may face. Monitoring Parkinson's disease symptoms from an early stage is vital for effective care. Keeping a detailed diary of daily symptoms can be a valuable tool for individuals and their doctors, helping to identify patterns and monitor progression. Health apps can also be helpful, offering reminders and allowing users to record subtle changes. If symptoms are recurring or worsening, it is essential to seek medical help for detailed analysis. Studies have shown that obtaining accurate records can not only facilitate diagnosis but also significantly improve treatment effectiveness. If you suspect that you or a loved one exhibits signs of Parkinson's, it is crucial to act promptly. Schedule an appointment with a neurologist for a detailed evaluation. Bring symptom records and any behavioral notes that might assist in diagnosis. Be prepared to discuss the complete medical history, including family history of neurological disorders. Ask about available diagnostic tests and explore treatment and therapy options initiated early on. Consider participating in support groups, as they can offer emotional and practical guidance, providing a network of shared information to deal with the condition more effectively. In summary, early recognition of Parkinson's disease signs can make a monumental difference in the treatment path and quality of life. By staying informed and closely observing any subtle changes in oneself or others, we can intervene before the disease progresses further. Armed with this knowledge, you can contribute to more positive outcomes and a more manageable future. We hope that this video provides valuable insights, equipping you and your community to make informed and proactive decisions. We encourage your continued participation in our informative journey. Subscribe to the channel and share this content.